Hey, my name is Dr. Josh Cohen, and I'm an ophthalmologist. I'm an eye surgeon. I've been in private practice for about 7 years now, and I wanted to make a video for those interested in ophthalmology, but really surgery at large, to kind of take a step back and contextualize what it really takes to become a surgeon. And I think that there are a lot of prescribed paths when it comes to pursuing a career in medicine. Of course, this is just my context and my opinion about, really my experience becoming a doctor and becoming an ophthalmologist. But really the goal of this video is to kind of contextualize and conceptualize what it takes emotionally and psychologically and physically to prepare yourself for career medicine and surgery more specifically. So I have 10 steps broadly that I think are important to take to become a surgeon. And the first step, of course, is to watch this video. So congratulations. The first step is, in fact, to gain knowledge, that foundation of knowledge, of which videos like this could be one of those ingredients. But really gaining that foundation knowledge is a years-long process. It could take a few years to kind of, build that scaffold of baseline understanding of anatomy, physiology, histology, all the basic stuff you learn in medical school. That is, of course, the foundation to becoming a surgeon. You really have to know what it is that you're cutting into, why you're doing it, but not necessarily how, at least not at that time. The first step is taking some time in the library, in the books, in your lectures, and just kind of learning as much as you can. So building that foundation of rote knowledge is critical and no doubt the first step. The second step is observation. So this is the time usually towards the clinical years in your medical school training, second, third, and fourth year, even into your first years of residency, depending on the specialty. This is where you are basically out in the wards, in the operating room, and just taking a step back and soaking it in. This is where you're watching surgeons do what they do. Your attending doctors, your senior residents, your fellows, and watching, and just kind of taking studious notes, of course, but really just kind of intently looking at what's going on. And I think that this is an important next step, because before you do anything yourself, you really have to see how it's done. And of course, you can do some of this online as well with YouTube tutorials or video training guides. But this is really just important to just see how things are done, and obviously gives you some idea of whether or not that specialty or that surgical experience is something you can see yourself doing day in, day out. This is the time where you might want to make adjustments in your career path, or maybe switch from one specialty to another. I know when I was in my undergraduate medical training, I was in a vascular surgery case that was several hours long, and I was like, I don't know if I have it in me to sit or stand for 5 or 6 hours at a time. I'd rather do surgeries that are 10 or 15 minutes. So ophthalmology seemed like a better fit for me. And an important note here at the observational stage: don't just look at the attending surgeon. Look at what the nurses are doing, what the circulators are doing, what the patient's experience is as well. Really take a step back and look at everything. See how the machine of surgery is done, pre-op, in the operating room, post-op care. All of that's important to take in at that stage, because once you're in the field of, the field of battle, so to speak, where you're the doctor and you're the surgeon, you have less time to appreciate what everyone else is doing around you. So after you've gained your set of knowledge, after you've observed how these surgeries are done, the third step is to practice. This is where you kind of take some time in the wet lab, where you practice suturing, you learn the different instrument types and nuances between different scissors. Like in our field, we have very small instruments. What's the difference between a 0.12 forceps and a 0.3 forceps? When do you use tooth or not? What type of scissors are necessary? All these little details, of course, you're going to gain as you go along, but now's the time to study up and kind of say, oh, when the doctor asks for this instrument, why is he doing that? And what's the purpose of that particular instrument at that time? So this is where you kind of practice a lot of those skills. But, suturing, scrubbing, sterilizing, prepping patients, how to clean the eye, how to drape it so that you don't get lashes in the way. All that's important to practice before you go in and do it on a real patient. This is also a great opportunity to use simulators. In our field, we have the IC cataract simulator, which is a virtual, augmented 3D surgical field where you put little, blunt probes in, and they be transformed in real time into the instruments that you're using in a simulated digital eye. Really nice to learn with that. We use a lot of the animal models, so pig eyes, for example, for different techniques when it comes to making incisions or practicing different steps of surgery. So this is the time to do that, again, before you go in and practice on someone, on a real patient. The fourth step I call fragmentation, or really deconstruction of the surgical processes. So this is where where you kind of take certain steps of the procedure and break them down into bite-sized bits that you can kind of get confident in. And again, in the context of cataract surgery, for example, there are different steps in terms of making the incisions, in terms of removing the cataract itself, even gaining access to the lens capsule. All these steps are their own distinct process, and some are more difficult than others, even if they're out of sequence. For example, the capsulorhexis, when we're opening the anterior capsule, that's one of the more technically challenging things that we do as eye surgeons, and that might be later in the process, even though it's early in the actual surgery time. So sometimes you do things out of order and you get some independent comfort levels with each of those steps before you put them all together in a surgery from start to finish. But that's important to do as well. And this will be the first opportunity for most doctors to really start doing steps on actual patients and gain confidence in those steps to eventually put them together. So of course, this leads us to step 5, which is the supervision stage. This is where you are in the operating suite with a senior attending physician next to you, scrubbed in, and you're starting to do cases from start to finish. And this is really where you start to kind of, put all your skills together, put everything that you've learned into this process and really just start practicing and getting comfortable with the surgery from start to finish. This supervised stage of surgery usually takes about a year or two, but this is really kind of, towards your residency stage where you are, becoming more independent, but you are still, of course, under the supervision and care of your senior doctors. The 6th step is gaining proficiency. So this is after you've done maybe a few 50 to 100 cases, let's say, you're getting more confident in the sequence of events, but you're just not efficient. This is really, again, where safety comes into play, but where you start to gain independence. Your supervisors start to take a step back. They may not be scrubbed in, you really are gaining autonomy. This is in your senior resident stage, maybe even early in your fellowship stage, depending on, where your comfort level is at that time. But this is kind of where you start to gain autonomy in the different surgery subspecialties that you are focused on. The 7th step is troubleshooting. This is where you start to encounter and prepare for complications. Now, of course, this will probably happen earlier in your surgical training as well, but this is where you've gained that foundational knowledge, where you've started to not only see how other doctors do things, you've been doing them then on your own for some time now, and you're starting to encounter complications, and this is inevitable. I think that if you are going to become a surgeon, you need to be able to stomach the consequences of surgery, good and bad. And you need to understand that there are processes in place to manage complications, anticipate them, and mitigate them, and treat them when they arise. So it's a very important, invaluable part of surgical education. And I think that once you've gained a few cases under your belt, your numbers have to get to a certain point where these complications will start to happen. And that's where you're gonna gain additional confidence, because you'll begin to anticipate and not be so afraid of some complications, and ultimately do whatever is best for the patient to give them their best possible outcome, despite events that may or may not be out of your control. Now, step 8 is where you really start to kind of transition out of your training phases. This is, again, in your latter months of residency or fellowship, maybe the first few years of private practice. This is where you really start to explore variations or personalization within the surgical process. So in cataract surgery, we have different instruments that we use to fragment and scoop out lens material. And maybe this is where you experiment with different techniques. This is when you're going to meetings and reading journals. And again, starting to get into the nitty-gritty nuances of the procedure and explore ways to make things not only more safe, but also more efficient. This is where you're going to gain speed on your cases, start to really get your numbers ramped up. You're kind of in the 500 to 1,000 cases at this point. This is where you've played around with different variations, and you start to kind of make the procedures your own, based on your own skill set and confidence, and kind of how you want to tailor your surgical practice. This is the time to do that. And again, this could take several years to really hone in on this. And truthfully, this is kind of an ever-evolving process, but this is kind of after you've done, many cases, you've seen some complications, and you know ways to adjust to make the cases better for you. I also think that industry plays a big role at this stage. This is when new technologies are coming out, and you can go to seminars and go to conferences and go to wet labs and kind of, increase your skill sets at this time. That will make the procedure better overall for you. Now, the 9th step is optimization. This is where you have done your customizations. This is where you have kind of settled, at least for now, on a steady state. This is where you start to experience that flow state in surgery, where you are doing things not mindlessly, but with deliberate attention and skill, dexterity, and comfort. It's not that every day is going to be a perfect day in the OR, but this is where you really start to get optimized and comfortable and very efficient in your care. This is probably where I am in my surgical development. Again, I'm several years out of private practice. I still think there's much for me left to learn, but this is also where you start to kind of optimize what are called personal nomograms, or your, how much astigmatism do you induce during surgery? And again, in the context of cataract surgery, what techniques do you really want to abandon? Which ones do you want to bring in? What are your outcomes? Do you need to adjust on their calculations? Instead of going off of just standard models, you've now done enough volume at this point in your career where you really start to make the outcomes your own as well. And you really can begin to, hone in and revisit your outcomes and optimize your surgical processes. And this process, I think, takes about 5 to 10 years, out of training. This is really where you really start to kind of get in a comfortable place in the operating room. You've really started to, take ownership and pride in what you're doing every day. And the last step is mastery. This is where you really are maybe 10 years out or more, kind of where you are a true leader in the field. You are someone who is teaching and educating. You are someone who can handle complex cases and deal with complex complications. This is kind of where you've done thousands of cases at minimum. You've gained a network of colleagues that you trust on. You're constantly collaborating and sharing information and material. You're reading journals and going to meetings and really kind of getting into the finer points of surgical care. And this is, again, like the end goal, I think, of any aspiring surgeon. Being a master surgeon is a lifelong pursuit. It might take 10 years, it might take less. It might take a lifetime to reach this point. And some might say they never quite reach that point, but that is the ultimate goal. This is where you are educating others. This is where you are producing outstanding, predictable results for your patients. Not infallible, no surgeon is perfect. Even late in their career, you are always still going to have complications and unforeseen consequences of surgery that you still have to handle. But ultimately, this is kind of the primary goal. And this is, I think, the end result of doing all these steps and also revisiting these steps, particularly steps 8 and 9, where you continue to personalize and optimize your nomograms and calculations so that you are constantly improving through different iterations in your career development. And I think that, this is obviously the goal. So I think that, if you can step back and see this sequence of events and say, hey, that's something I feel like that I can do, and I can put in the hours and I can put in the reps, and I could see myself, putting in thousands of case hours in independent training to become a doctor and a surgeon, then this is a career for you. Now, of course, there are other things that come into play. For example, there might be some physical limitations based on, your dexterity, or what we call stereopsis, like your ability to see in 3 dimensions. Some people can't get used to microscopes. Some people can't get used to loupes. There are different, specific elements of care that you will, of course, encounter along your journey, which might change your course direction. But these 10 steps, from gaining a foundation in basic medical education and then anatomic knowledge, all the way to true surgical mastery and optimization, this is the timeline that I think most surgeons follow, and it does take a long time. I estimated for this video about 10 years or so from the start of your surgical training to the end to kind of reach that state of true comfort in the operating room. But it's going to be different for everyone. Yeah, I hope this was informative for you and maybe enlightening. If you're a surgeon now or an aspiring surgeon, I'd love to hear your comments and thoughts below about what you agree or disagree with in terms of your personal development and what tips and tricks you might have along the way to help future doctors. So thanks again for your time, and I will see you in the next one.